Hello, and welcome to the introduction to the Healthcare Emissions Impact Calculator. My name is Keith Edgerton. I'm the U.S. Associate Director of Climate Solutions for Healthcare Without Harm. I support U.S. health systems in their efforts to decarbonize and build climate resilience. I am so excited to share this brand new calculator with all of you. This greenhouse gas emissions calculator will allow you to calculate your emissions at a facility and the system level for healthcare. This is a free tool for all U.S. health systems. Before we get into what the tool looks like and how it works, I think we should talk about why is this important? Why should we calculate our greenhouse gas emissions inventory? Well, I do think there's quite a bit of scientific evidence out there that shows we are currently in a climate crisis. The Mitigation and Adaptation Report from the IPCC Sixth Assessment that came out in late February 2022, I think captures where we are perfectly. The cumulative scientific evidence is unequivocal. Climate change is a threat to human well-being and planetary health. I was happy to see that healthcare was included in this report for the first time, saying strengthening the climate resiliency of health systems will protect and promote human health and well-being. I also found this fact quite startling and informative. We have used 4/5 of our total carbon budget to avoid a 1.5 degrees Celsius increase in global temperature. If we stay within that carbon budget, we still only have a 50% chance of not having a 1.5 degree increase in global temperature. So if your organization has not committed to a science-based target of net zero emissions, I highly encourage you to do so. We must act now. A net zero emission goal is reducing all of your emissions by 50% across all three scopes by 2030, and achieving net zero emissions across all three scopes by 2050. I'd also like to share some resources that may interest Practice Green Health partners. These are all available to you. Obviously, we're talking about the calculator today. The how-to guide for Scope 3 emissions is fabulous. Scope 3 is obviously a very large scope of 15 categories. This how-to guide really breaks down how to calculate each category of Scope 3. Climate Resilience Planning Cohort Group is a great example of where you can get together and learn from your peers and work together collectively to increase community and healthcare resilience. And there are many other virtual events and resources that can support Practice Green Health partners. So now let's jump into the tool. I'd like to show you the facility tool first. Both of these tools are a Excel-based calculator. You'll see on this first page under instructions, you're going to put in some basic information and you're going to choose the EPA region that your hospital or system or facility is located in. You also are able to provide a bunch of data about your facility. This is all optional. You can put in as much information as you want or as little. You're still going to get results in the results and summary tab. All of the green tabs at the bottom of this sheet are for Scope 1 and 2 emissions. All of the blue tabs are for Scope 3. Once you get in the facility data that you want, you're able to then jump into Scope 1 and Scope 2 emissions. If you have not done Scope 1 and 2 emissions before, you probably are actually collecting a lot of this data already when it comes to building energy. So let's go through this quickly. Stationary combustion is directly controlled by your organization and fuels are combusted on site. Mobile fleet combustion is from the fuel that you purchase for your vehicles, whether you own them or lease them. And then we jump into fugitive emissions. And fugitive emissions are going to cover waste anesthetic gases, refrigerants, and fire suppression. We have a very robust list of refrigerants to choose from. We also have all of the waste anesthetic gases that you are currently using in your facility. Once you get in the data that you want, you're able to go to the results and summary page. Everything is in metric tons. It breaks it down per activity or category. It also shows you the percentage of each scope and each activity category of making up your total greenhouse gas emissions footprint. We included scope 3 here for the ease of seeing your numbers, but we also have this embedded in the scope 3 tool itself. You'll see a bar graph showing your emissions for each category, and then also a total number for each category. Once you have filled out all of the facilities that you want to cover, you would then jump into the system tool to bring them all together. Again, Excel-based, you put in your health system, the amount of facilities you are importing into this tool, and all of your facilities would be put into one folder. You can upload as many as 300 facilities into this calculator, and you don't have to do it all at one time. You could do 20, add 20 more, add 50 more. And so you choose import data, it brings it all in, and then it breaks it down. Here's your system total. Here's your totals for each facility you brought in. As I mentioned earlier, if you want to put in all of this information about each facility, it'll quantify this all here for a system. Same for each scope, each category. And I duplicated one example. So these percentages for facilities are going to all be the same. But in your world, you're going to have different numbers here. And this is a great way to see the outliers. The facilities of similar size, similar amount of beds, similar amount of ORs, and one has extremely high stationary combustion and the other one doesn't. Maybe you're able to find where you have high achievers and facilities or hospitals that need to do a little more work to lower their emissions. Same would be true with scope 3. Maybe you do some large purchases as a system, but you may have some individual purchasing at the facility level. So this is a great way to see your overall emissions and the large categories, and then also who are your outliers at the facility level. So that concludes just a brief overview of this calculator. I encourage you to download it and take it for a test drive. And while you are developing your greenhouse gas inventory, if you haven't done it before, or maybe you've done scope 1 and 2, just remember that this is a journey. You're not going to get this all done in a month. It's going to take some time. Our scope 3 tool is a spend-based methodology from the EPA. So I know your organization tracks costs. You probably take some time to find the correct person in your organization, but once you get that right data, you're able to plug that in, and it's going to give you a really good estimate of your emissions for scope 3. So this is a journey. Take your time. It's going to get better and more robust and more accurate as the years go on. Be transparent, be as accurate as possible. There's no wrong way to do this. You're not going to get in trouble because you didn't have all of your scope 1 emissions correct in your first year. Explain why you included activities or excluded. And then also remember that you can't wait to start decarbonizing until your greenhouse gas emissions inventory is done. We must act now. We must hit this milestone of reducing our emissions across all 3 scopes by 50% by 2030. So while you're developing your inventory, look at what you're able to do right now in your area. Reducing scope 2 emissions is pretty much available for everyone in the US. It may be a virtual power purchase agreement. It may be purchasing community solar or installing on-site solar. You can absolutely reduce waste anesthetic acid right now. It's pretty easy to do, and you'll save money while reducing emissions. So pick the ones that are easy. Pick the ones that are going to save you money. Start small, start with the easy stuff, and then over time, tackle the harder elements or activities to decarbonize your organization. I hope you found this helpful, and I can't wait to hear some feedback from you all using this tool, and look forward to seeing you at the next Clean Med. If you are not a Practice Green Health partner and you feel like some of these resources will really be helpful in supporting you on this journey, I highly encourage you to join Practice Green Health. Thank you so much.